I found a couple of other shareable articles.
It's going through now. I think. Yeah, there it goes. All right, Dr. Malone, it's Friday, April 24th, and we're downtown Pensacola. You're at your home office. And we wanted to do in this week, in the 6th week of our remote working for the firm. I spent most of the day here with one staff member. We had a deposition, virtual deposition in a medical malpractice case, a wrongful death medical malpractice case. And then we saw one new client via virtual Zoom conference. So, but we're here to mainly talk about your take on both the local and national COVID scene. We're going to end this 6th week of these streaming videos tonight, and then we're only going to do these in the coming weeks as events present themselves and we feel like there's maybe the local community wants to hear something from a local physician. If there's a serious legal issue that comes up, or of course the medical issues that come up, if they're significant, you know, we may come back on and do a live stream, but we're probably going to just concentrate our videos moving forward on what we've had done in the years prior, which is the personal injury stuff that we serve our clients with. So, but anyway, let's talk about COVID again tonight. What's the update on the local numbers?
Local numbers, not a whole lot of movement. I don't think that the afternoon numbers are fully updated quite yet. Again, they usually do it at 5:30 our time. I haven't seen any budging yet. However, we were at 418 2 days ago, 420, now 434 as of midday today, as far as local infections. And there was a leap of 200 tests that were accounted in the last, well, let me back up. Looks like there was a leap in about 500 tests in the last 2 days. So that may have included some of those walk-up testing sites that we saw. So I don't know if that's the amount tested. I don't know if they've resulted all the either positive or negative results on those. So they are capturing some of that data there. No real big movement on the long-term care facilities either. It's still 143, which is where we were yesterday. One additional death in the county, and I believe that one, from what I saw, and I can't be certain, I think it was associated with one of the long-term care facilities, though none of that is public. So not a whole lot of movement there. Otherwise, I did see that there is going to be some other testing next week at a site in Cantonment, and I think a couple of other to be determined sites, and that was per the county release this afternoon. So I think the testing is still going to be getting out there, and if you're interested or you feel you need to be tested, and pay attention in your community and see what time it is. Sounds like there was a high demand this week at the 2 locations they did it at, on Wednesday and then again today. So that's the local stuff there. Okay. Social distance scoring still is a D. And
I have a feeling this weekend's going to be an F for both Santa Rosa, and I think everybody's just.
Yeah, I think it's a lost cause.
They have the fever for being outside right now. So
yeah.
Downtown looks busier than it has since the beginning of this quarantine stuff. It is constant traffic back and forth, north and south on Palafox right now. There's not only cars parked up and down Palafox, there's cars parked down Ramada. So there's people everywhere. They're walking. They're using the ATM. There's a fire truck from Engine 1. Fire Station 1. So anyway, it just looks like almost like a typical Friday afternoon down here. So I have a feeling that our score is going to go even lower. Now,
and probably stay down there is my guess.
Right. So we won't know the effect of all this socialization that's happening though right now for a couple of weeks. All right. Like if the virus is dormant, or if there's a bunch of folks out here on the street right now that are asymptomatic carriers, if this weekend, for instance, is a launching pad for some of these social events, and people start communicating the disease to one another, and that disease could be dormant up to 2 weeks, right?
Correct. And the social distance score really isn't tied to infection rate. When they established this whole thing, it was based upon baseline of what people's movement was before the pandemic. So they looked at GPS beforehand, and then they established a baseline with whatever their formula was. And then they said, okay, now compared to that baseline, how are we doing and where should we be? So it really is to, if you were to see big peaks or big valleys on the infection rate, then you look at and say, what was going on with the social distance at the time?
Right.
I think the problem with you, with what you propose there is we've been hanging out in the D range for so long, or the C- range for so long, that if you see a blip up or down, what do you associate it with?
That's true. Good point.
I think if we went to an extreme of like all of a sudden we're getting A's and B's, and then you saw our infection rate go down, you say like, see, look, it works. Or the opposite, if it was a polar difference of the relationship, meaning if we were A's and we were all of a sudden having tons of infections, then people say, well, wait a second, social distancing is backfiring. So this was just more like as something to associate with, and a grade. It's like one of those things to keep someone motivated. You give them a grade. You say, dude, let's try and get to that C or that B or the A. But I think, candidly, my opinion, I think some of and this is a lost cause. I've been just including it just more for curiosity and association than anything. So,
okay. All right. So what are we looking like from a national standpoint today?
National standpoint, well, across the threshold of 50,000 deaths in the country over the course of between last night and right now in the last 24 hours, we're at 51,000 deaths and 890,000 infections. So we'll be crossing that million threshold here probably within the next week, I would imagine, because I mean, a week ago now we were at 750, and now we're at almost 900. So it's going to be real quick before we get over a million. So those will probably be the things that you see making headlines nationally. I guess on a national level, the press conference today, president's press conference is rather brief and early, so it's over already. Not a whole lot there. There's more talk in reference to some of the stuff we talked about last night with the DHS presentation that was given. And at the time, well, at the time I said, hey, I don't have time to pull up the slides, and they weren't publicly available. Well, I look around enough corners of the internet, and I found the leaked. This was leaked, I guess, even before yesterday. This is the DHS document. You'll see on here for official use only, unclassified, and April 13th. So they kind of were saying, let's look at the surface stability of this thing in the green column. It says the virus is most stable in cool, dry conditions. It decays faster in higher humidity and temperature, much faster in sunlight. That was basically what we saw the synopsis of yesterday, the top green box right here. All right, and then they're saying what can kill it: bleach and 70% isopropyl alcohol both work well when using manufacturer's recommended contact time, which is that 30 seconds we talked about last night. And so they're talking about what the impacts would be and how to move forward with this information with R&D. And kind of interesting, they show on here, here's the results. This is basically what his punchlines were yesterday. Virus lives longer, low humidity, inactivates faster than higher humidity. Lives longer at lower temperatures, inactivates faster at higher temperatures, and then sunlight destroys it quickly. So interesting document. Here's the temperatures and the humidity where they saw the drop-offs, and they put the percentage in there. Low humidity of 20% is fantastic for this virus. The virus loves that. And then higher temperatures obviously destroy it quicker. And so the full intensity of the sun half-life is about 2 minutes, half intensity 3 minutes, quarter intensity, and then no light, dark. The decay is greater than 60 minutes. Right. So you want UV light and not light from in your house. You want natural sunlight. So it's pretty interesting just kind of going through this, and then they use the different concentrations of the bleach. So this is more of the scientific background of it. They're showing the survival of the aerosols over time when someone sneezes. and then the size of the particle, and then concentration over time, where you're saying, hey, is this how can I walk through a sneeze cloud basically in the grocery store? So it gets a little bit more boring as you move on, but I did find that, and so I guess
That's
that's
interesting.
more of their that's more of their homework. They just showed us punchline yesterday, so I guess it's good news for people in environments like ours, and I don't think it's an excuse to just lay all your caution aside. You still have to be
Right.
cautious, but it lets you know that this is new information we didn't have before, and they're finally studying the real virus, which I think it's astounding to know that they got this thing bottled up somewhere and they're doing these kind of tests on it. Can you
Right.
imagine the people that are working on it have to be dressed up in, like spacesuits.
Hazmat. Right.
Yeah, yeah. So that was interesting there, and then found a couple of things I thought were interesting to share on a Friday here. So they keep on saying, don't touch your face and it can get through your nose, right? Well,
Right.
here we are, more people, more time, American ingenuity, let's try and study this thing. So they decided that the nasal epithelial cells express the highest concentration of the ACE2 inhibitor in the body. And that's where, if a virus had an ideal port to enter our body, it'd be through the nose. And they basically said we have the highest concentration here, and it's the easiest way to spread it. It's because your nose is it's right on the front of your face. That's the thing that people look at when they talk to you. That's the thing that absorbs the air when you're talking to when you're speaking with
Right.
someone else. So it's a perfect port for entry and transmission. And they proved it. It's the goblet cells and epithelial cells of the nose. And they studied. This shows you kind of what they're talking about. Those are the cells in the nasal mucosa, the cells in the lower airway, and then the cells in the parenchyma of the lung. There's not nearly the concentration down lower in the lung. It's in the nose. So that infection enters and reproduces the virus in those cells of the nose. So I thought that
That's why those swabs are going in the nose, right? Because that's where they're
yeah. Yeah, and it's in hindsight, it's good that the swabs were going in the nose, because that's where you're catching them. If you're doing the tongue, maybe you're missing something.
Right.
So the nose is it, and I guess that shows that there's some. And keep in mind that the nose and the mouth, the oral pharynx, are connected in the back. Okay, so when you sneeze, there's a combination of saliva coming out, and then whatever's in your nasal cavity. So it's not to say that a cough is worse than a sneeze or vice versa. Everything communicates in there, but the nasal mucosa is the entry point, and it's the point where you can spread to someone else pretty easily. So wiping your nose and then touching something, that'd be the scary part there. So I found that, and that is recently new information. And then here's let's see here. This whole time along, you've been mentioning, China. We can't trust China, right? So now we got a group of Americans that have gathered some information on the Chinese numbers, and they're saying that they put together a couple of different models, and they're saying that the modeling that they're using to lay a number on the rate of infection and all that is probably about a factor of 4.
Yeah, I believe that.
Yeah, and some of the models say it could be about 7.1 times higher. Some of it could be about 2.8 times higher. But the most reliable model that they think that they can lay their thumb on is about a 4 or 5-fold increase in whatever numbers you see published from China. It's probably 4 times that. So there's people out there, these statisticians. Really, this isn't medical. This is. Yeah, so these are statisticians.
They don't want to look bad to their citizens, but in the meantime, they don't care about providing us accurate data. And we're trying to fight this thing, which is aggravating.
Yeah,
there have to be. After all this is said and done, there has to be consequences for them, because you shouldn't be able to do this.
And I guess the closest parallel I can draw is, for a period of days there, you and I and a bunch of other people locally were saying, we don't even know which nursing homes we're talking about. Like, they need to tell these people, like, this is
right.
So that was a micro scale of this, the China not telling other countries. So other countries, neighboring countries, but the countries that are having travelers or people moving back and forth from China for via work or vacation or whatever. To not disclose that is,
Well,
I think
my
that's
my
harmful.
suspicion is that they were thinking, well, what is the possibility this is an intentional bio warfare type situation? And so I can understand them not talking about it at first, because they want to try to figure out, okay, let's make sure this is like a natural kind of disease process. And then, but once they figure out it is a natural disease process, that's when they should have said, okay, look, just letting everybody know this is happening, and here are the numbers, and it's bad, and you need to go ahead and do the following things to your country because it's coming.
Yeah.
And they didn't do that. But all right, sorry, go ahead.
So, all right, so this is my last slide for a Friday ending on, and I won't say it's funny, but it just lets you know that you get far enough into something and people find everything to study. Okay, and so this is, let me get it pulled up here. Hold on.
Seminal fluid. I saw that.
Yeah. Let me get. So they studied. I'm trying to get the punchline here. They studied the semen of infected males, and
how do they go
found,
about getting that?
there's a collection.
There's people in ICU and they're asking them to give samples of their semen. How does that happen? Seriously, are these people asymptomatic folks? Maybe it seems a little odd.
They were infected individuals, and they didn't disclose in here, at least, the collection method. So, but the idea is, A, can it be transmitted this way, and B, would this have a detrimental impact on a male's ability to reproduce? So the reason why that comes up is because there are infections out there that can cause that can be related to sterility moving forward, where the ductwork or the tubules that communicate the semen, or in females, the ovaries communicate the eggs. Those can get scarred down, and basically the path of travel is blocked, and then you're sterile. So they found that there is no basically no effect. There's no COVID in the semen that they collected.
Wow.
And they didn't see any long-term real anything bad long-term right now based on this information. But it was basically semen analysis looking for the COVID. It was not detected after 31 days.
These doctors, don't these doctors have better things to do than
I told you this?
You get semen samples to figure this stuff out.
You give someone enough time, and this was in a fertility journal. Fertility and Sterility is the journal. So there are people out there. There's a niche for everything in medicine.
I guess there is a concern, if somebody's got the disease, are they going to be infertile, because of the disease? I guess that would be okay.
Yeah, right. That's really what it was. It wasn't, is a male going to get someone else infected because of semen? Right. I would like to think that the infections are going to happen through your nose if you're close enough to, I guess, consummate. So it's I think that's
suggesting semen's in the nose. You're saying just the body parts.
It's intimate contact with someone. Your noses are close enough to one another. I think that'd be the reason why you'd infect someone as opposed to the semen.
Okay, I got you. All right, but so let me ask you a professional opinion about something. So everybody's sort of antsy to get out. The weather's great. It's been raining a couple of days this week. It's supposed to be, I guess, a nice weekend. I don't know. Last weekend was sort of crappy. Weather-wise, everybody's been sort of minding their stay-at-home stuff. What are you going to do this weekend? Are you getting out of your house? If you get out of your house, are you going to be around people? What do you recommend?
My plans include basically the same plans as the last many weekends. It's a workout with my wife, and which means we're outdoors running and on the stationary bikes inside, and maybe some yard work again, just at the house with us. And if
no
anything,
crowds.
maybe no congregating with crowds. I mean, we got to make like the weekly run to the grocery store, but I'll tell you what, I went to the grocery store. I think I've been like maybe once a week for the last 6 weeks. And last week when I went, it was the first time that I went and they had the directional arrows in the aisles. And I would say there was more people with masks on than not. And I had my mask on. I was pretty deliberate. I mean, I went through there like I was on a mission, and it was grabbing one thing off the shelf and not shopping around looking at the labels and like, hemming and hawing about anything. It was a pretty directed path. So
right. And
we'll do something again like that.
And I have made the decision here at the office that we're not coming back to work here at the office until I can test people or until there's some treatment. So what would you tell people as far as, let's say that within the next couple of weeks or next week, because we may not be back doing this subject next week live, what would you look for before you would congregate with other people?
I would look for probably a slowdown on the local infection rate. I would look for, I guess, in my personal life, like where I need to be. So if my day-to-day employment or whatever trade I'm involved in required contact with people I don't know frequently, like customers walking in and out of a storefront kind of thing, I would personally be more hesitant there. But going to like an office building where there's really just a close group of people and you have a good handle on like the way that they conduct themselves when they're not at the office, meaning, they're either at work or they're at home. They're not at work and went to a concert and went home, that kind of thing. Right. Then I would feel confident there. But that's hard to control.
When do you feel confident? Like when there's tests available? Like that's my thinking, is that I don't think that anybody should be doing anything different until there's widespread testing available. And because you really don't know what's going on until there's widespread testing available. And when there is,
widespread testing with a short lag time with the results. And so if you get a hotspot, you're seeing a hotspot pop up quick, not, hey, we think we had a hotspot last week. And you're like, well, it would have been nice to know then. So I think a rapid turnaround on that information would be something I'd want to see. And I personally know that whenever it's time for me to get back into, I guess, a routine with going some places, and just inherently, I'm just going to be hesitant to like shake hands and like to have close, like normally I would see someone I haven't seen in a while, go up and see them in the store, shake their hand, how you doing? I ain't going to do that. I'm going to wave from across the aisle and it's going to be small talk.
Hey, how you doing?
It's going to be very removed. And I can see that happening even in workplaces. I mean, you're going to sit down and have a meeting with someone and you're sitting on the opposite sides of the table and you're not going to walk in and out of the room at the same time. Let them go, and then you'll go do your own thing and grab the handle with a little alcohol swab. Right. So I think that's going to go on. But yeah, I agree with you. When there's more testing, and then when that testing is being viewed rather quickly, and you're seeing, okay, wow, there's 2,000 tests in the last day, and only a small percentage of them were positive. Okay, I feel like my chances are pretty good. All right.
So what we're going to do as far as this subject is concerned is we're going to just monitor the situation over the weekend and next week, and we'll come back on if something significant happens either locally or nationally that we think deserves some interpretation by a physician. And we'll come back on and we'll give some notice before we come back on. But in the meantime, we're here. The office is open. We work 24/7, basically, in taking new cases, mostly car wreck cases. I have been somewhat happy that we haven't had a lot of car wrecks lately. I have a feeling this weekend's going to change that. So unfortunately, because everybody's out and about and everybody's happy to be out and about, I did see a couple of road rage people this morning. So I think people are also very stressed. So if you find yourself in a car wreck or any kind of personal injury situation and you need a free consultation, or you need a lawyer, one of the two things or both, you can find us on the web at zarzarlaw.com. Your cell phone, just type in Zarzaur or Joe or I Hate Joe and it'll come right up. The phone number is 855-HIRE-JOE. Other than that, you can comment on this video underneath here, and we look forward to seeing y'all next week sometime, either on this subject or another subject, one of the subjects we talk about a lot. And y'all take care and be safe this weekend. Thank you, Dr. Malone.
Thank you.